Hi, I already mentioned at the Sahana also has sent the message. This is an informal coaching for those who are with us for some time with tailor-made eating patterns, with specifically designed to manage their weight or obesity or high cholesterol or hypertension or diabetes. That is only one part of the story, but there is a lot beyond we can do to improve our health, to optimize our health. Many times when these 15 to 20 minutes call, when we do, we are not able to address these things. And also it's not unlike other hospital specialities. Lifestyle medicine is not an emergency specialty, emergency medicine. It's something which you can do. You can guide your people at your convenience or at a mutually convenient time using technology. It just needs the right guidance, and with the right guidance, the patient or the client needs to adapt to that lifestyle. Okay, so lifestyle medicine is a new clinical specialty where evidence-driven, evidence-based practices are used. Basically, 60-70 years of compounded research has gone into picture with respect to diet and lifestyle in chronic lifestyle diseases like diabetes, heart disease, cholesterol, etc. And these have formed into a guideline of practice in medicine. And it is handled by doctors like me, medical doctors or allopathic doctors who have certification from International Board of Lifestyle Medicine or IBLM or ACLM, American College of Lifestyle Medicine. So me and Dr. Prapti both are certified, diplomats of American College of Lifestyle Medicine. So let's begin the journey to a much higher level with a proper lifestyle adaptation with respect to all the six, I should say that seven pillars of um, uh, lifestyle medicine. So let's look at the pillars. We call this December month a preparation phase for getting into an extensive lifestyle adaptation view from January. Okay, so that preparation phase will be addressing areas related to the lifestyle factors. We all know that one of the lifestyle factors we address, basically we address your eating pattern, your exercise pattern, your stress, sleep, basically your healthy relationship, how to build and maintain healthy relationships, and other habits like alcohol and smoking. And as a IOH and as a strong advocate of planetary health, I also recommend healthy living, which is designed around that actually. Okay, that we'll discuss in the last phase. So and the preparation phase, I'll be discussing a lot about the grocery list you need to have, the exercise support, the accessories you need to have, meditation lessons, what all kind of videos or kind of activities which can be used as meditation, sleep enhancers, then alcohol and smoking stoppage strategies actually. And then we also help people with the calendars. Some of them are very bad with maintaining relationship, how to call a long lost friend, those kind of scheduling activities we help. So coming to the grocery list, before getting in depth about the grocery list, because we are all following, not even if you're with IOH, I should say that I see a lot of plates. I think we are following around 50, 60 or 70% of the recommendation. Many cases people find it difficult to increase the vegetable and fruit intake. See, 4 to 5 servings of vegetables is what we say, or 2 to 3 servings plus 2 to 3 servings of fruits. That much level of fruit and vegetables getting into your body, definitely most of us who are highly grain oriented or meat oriented people definitely face issues actually. So to manage that, there is a pre-prep phase actually, where I suggest all of you do a deworming session actually. Like deworming, you can do it with Zendel, like it's very easily available. You can just Zendel, Indian scenario, you can get Zendel 400 mg, and you can do one or two sessions. One if you're doing on this Saturday, next Saturday you can repeat that. And second one is actually, once we do the first dose, after that you can start with the multivitamin supplement. Basically, we ask you to follow the following ones. Basically, in Indian scenario, anything with Supradin, Centrum, you know, um, Zingo with B complex forte with zinc. Any of these things are fine actually, once a day for 30 days. This is just because we are already deficient in micronutrients, I'm sure, but like during the phase of adaptation we may get into a little deficiency. So to manage that, it just can be given for 2 to 3 weeks or 4 weeks. So a multivitamin, which can include any of those ones in an Indian scenario. For outside India, Centrum is what we normally see people taking it. Actually, it's available. It's an OTC. You can get it online, and you don't have to do more than a month or so. But keep in touch with us and inform us the dosage and all. And we also recommend a calcium supplementation in many cases where people are not having enough calcium sources, especially with the issue with the dairy products, like many of them are going off dairy, so it's better to take a calcium supplement. Vitamin B12 and D supplementation to be done based on the levels, your blood levels. Actually check if you have done already the check and the doctor has recommended, for 8 weeks continue the same, or in case you haven't done that, actually it's better to get a check done and do it. And if you are not doing it right now, ask your doctor, either Dr. Prapti or Dr. Ashwini or any of us, and just start at very low dose these supplements actually. And another one is omega-3, which is regularly lacking in our food. People who are taking oily fish regularly, I don't think we need to be bothering much about it. Or people who are taking nuts and seeds regularly, 1 ounce, which is like 2 tablespoons of them regularly, then don't worry. Otherwise, it's better to take an omega-3 supplement. The brands which we normally recommend are GNC's brand and Univit for vegans, and GNC also has you can have Wow brand, which also has a good animal based one. Any of these supplements are fine. So I told one vitamin supplementation, multivitamin supplementation, calcium in many cases, and vitamin B12 and D if there is deficiency, and omega-3 supplementation for a month. So the brands also have informed. Now coming to like getting our gut ready for these journey. Basically, as I mentioned, many people when they start taking higher doses of fiber in the form of vegetables, fruits, and legumes, there is always an indigestive issue or flatulence and multiple of these conditions. The reason being we don't have enough those bacteria which can convert this fiber into beneficial products like short chain fatty acids, which has a huge impact on our health. It can help us prevent multiple health conditions actually, but that's lacking in our system. So we need to build that actually. Short term, we can build that by adding a probiotic into your system. So these probiotics can be, natural ones are ideal, but it takes time. So I suggest 2 to 3 weeks of probiotic supplementation. You can use, in Indian scenario, we can use Bifilac, Velgut, Bisilac, any of these supplements, which is again OTC. You can online order it and have once or twice a day for 2 to 3 weeks. And Centrum has good brand for the foreign clients. And in UK, we have already given multiple people with IBS and multiple other conditions. It's Simprove is one good brand, but it's very expensive. But people who are not ready to pay that much, you can go for Biomed. So this can be taken for 2 to 3 weeks. It has huge impact. So gut health, you should see a lot of videos on YouTube for common man's understanding. It's very good to start improving your gut health first. So this is the first step. Once you are done with this step, we will start storing your grocery, getting your grocery list ready. Basically, your storehouse or your grocery room should be properly designed. Actually, first and foremost, you should remove all the unhealthy stuff like the chips, the cakes, the cookies, all these things should be out, and you should fill your bottles with nuts, seeds, good legumes, herbal seasoning, spices, and things like that. Actually, so what are the nuts we recommend? We recommend almonds, walnut, pistachios, cashews. Okay, and seeds. Basically, we again recommend the omega-3 rich flaxseed and chia seed. Flaxseed has double the quantity of plant-based omega than chia seed, but chia seed has higher fiber profile, so both are good actually. So 1 kg for a month should be sufficient. And then you can have legumes is something, one, like I would strongly recommend one serving of legume per day. One serving is half a cup or 120 ml cup legumes a day to start off. So that is very high in fiber and many other nutrients. It's called the longevity food. So there's legumes, you can have red lentil, yellow lentil, black lentil. You can have all type of beans like rajma, cowpea, different type of cowpea. Then you can have double bean, horse gram, green gram, multiple of these things. Buy all of them. It's available on Amazon. People who don't have grocery shop which provide this wide variety of legumes, you can buy it online. Otherwise, if your grocery shop provides, that would be good. Then actually, like some of these herbs like oregano, parsley, thyme, rosemary, um, the basil seeds, some of them comes with very high antioxidant potential. These ones are to be bought and kept in small bottles so that you can add them to your salads. It has a very high antioxidant potent antioxidants, because it's small quantity, it provides large amount of antioxidant potential, which is very useful in protecting us from cancer and many other conditions. And then spices and all I need not mention, because we already have these. And grains, grains, okay, like people who are ready to make these transformation can do it. The theory with the concept with grain is, so you need to be like rotating the grains. Don't use the same kind of grains every day. For example, our staple grain, mine is rice. So go for whole grains like the brown rice, the red rice, and those kind of things. So that where the bran is still there actually. Those kind of whole grains, brown rice kind of thing. Use it for 3 or 4 days. Rest of the days use other grains like millet some days, and quinoa, amaranth. You can use oats. You can use or replace grain with your legumes as a main dish one day. So that's how you need to be doing it. So fill your grain boxes with whole grains rice. Different type of rices available. I have seen people using Rajmudi rice, Kerala strong red rice, and matta is not very whole grain, but it is 50% or so. But other red rice is there. I think I've used something, I forgot the name. I'll tell you. The wild rice is another one. Any of these rices are very good. And third is, millets, different type of millets like ragi is something which you can use as a porridge, or you can use it for your dosha and all. Actually, it can be a flowed one, it's fine. But the foxtail millet, and it's very similar to quinoa. You can use it as a foxtail millet salad or foxtail millet. So quinoa salad, actually, both are very good. So quinoa is one, foxtail millet is one, and you can also use the sorghum, that one, and different type of grains which is available, and which you're able to use it actually. The broken wheat, the whole oats, all these things can be used actually. So store all these things nicely so that you are every time reminding yourself that you are on a healthification journey, optimizing your health, like that journey actually. So please keep reminding yourself that actually. We call it like make it obvious that you're on a journey actually. And then regarding regular produce, we'll keep informing you. So the ideal scenario would be like don't buy it for a week, buy it for 3 days, and then 3 to 4 days, and keep buying it actually. Like the better, the fresh the better actually. So get some of these people who can deliver these the produce at home. Some of them basically you should be focusing on non-starchy grains, color and variety, where you can have green leafy vegetables, lettuce, amaranth, palak, methi. In US, here in Bangalore also we get all these Swiss chard and kale and multiple other things, whatever is available, seasonally available, locally grown. Here in Bangalore, we have seasonally available, locally grown Swiss chard and kale, which is very good for smoothies. and you can have anything, amaranth to methi, anything is a good leafy green. Second is colored vegetable. Colored vegetable has again higher antioxidant potential. Phytonutrients are beautiful in them. So lycopene rich tomatoes, the, different types of cabbages, uh, broccoli, dark green vegetables like broccoli and all, cauliflower, cabbage, that those are called cruciferous vegetable. Again, antioxidant potential is very high. You should be using them more often. And then you can also include the root vegetables like beetroot and carrot and potato occasionally. Potato, the rule we already know that potato is a starchy vegetable. You can always replace your grain with that. And then coming to the fruit seasonally grown, locally available fruits are the ideal one. But just check what is seasonally grown in your area. Locally grown and seasonally available ones in your area. But right now here in Bangalore, we get pomegranate in plenty, grapes in large numbers. Then definitely there are apple and pear and those kind of things. Actually, whichever is available in your area, please get it.